this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today again is Margie Propp. Thank you, Margie, and thanks to everyone for joining us. Today I'm going to start off talking about vaccine for 5 to 11-year-olds. And give you an update. The Center for Disease Control and Prevention approved COVID-19 vaccine for children 5 to 11 years old last week. This is really exciting news, and now that Pfizer's children's vaccine is available for this age group, our goal is to help get them protected as quickly as possible. The health department is partnering with our school districts to host vaccination clinics at local high schools and other locations within the city and the county. And you can see some of our activity from Saturday. On our first clinic at Lincoln High, our appointments filled up really quickly. We were off to really a strong start vaccinating those 1,500 children. We wanted to create a welcoming environment, and that was kid-friendly, and people wore fun hats and costumes. There were sticker table, there was a photo area, and the Lincoln Fire Department provided tours of fire trucks out front. And a big thank you to our health department staff, our partners, and our volunteers who went the extra mile to provide a positive experience for these children and their parents. Dr. Kimberly White, a pediatrician with Complete Children's Health, was at her clinic on Saturday, and her daughter was vaccinated. She's joining us today to share more information about COVID-19 vaccine for children. Dr. White?
Thank you for the opportunity to be here. As you heard, my name is Dr. Kim White. I'm a general pediatrician at Complete Children's Health here in Lincoln. I'm also a mom to a pretty awesome, thriving 5.5-year-old girl who, as you heard, got her COVID vaccine on Saturday. As a pediatrician and a mom, this is a day we've been waiting for a very long time. And I am thrilled we now have a way to protect our 5 to 11-year-olds against COVID-19. COVID is not without risk to our kids in these age groups, age 5 to 11. Over 1.9 million children have been infected by COVID, leading to over 8,000 hospitalizations. And about a third of those hospitalized, they were in kids who had no underlying medical problems, which means we don't really have a great way of anticipating which kids will have complications from COVID. Unfortunately, we've even had deaths due to COVID. 94 aged 5 to 11-year-old kids lost their lives to the virus. But I am happy to say that we now have a way to protect against future deaths due to COVID, and that's by way of this vaccine. The Pfizer-BioNTech company conducted a thorough clinical trial which showed that there is both a safe and effective vaccine for 5 and up. When I say effective, the trial showed in about over 3,100 kids who received the 2-dose series that it prevented COVID infection in over 90% of the cases, which is huge. I also said that the vaccine is safe. Sure enough, in the clinical trial involving over 4,600 total kids, again, about 3,000 of those received the vaccine, there were no serious side effects. When I say no serious side effects, there was no myocarditis, which is inflammation of the heart muscle, no counts of anaphylaxis, and in fact, the most common side effect was really pain, tenderness, and redness at the site of injection. And compared to 16 to 25-year-olds, kids in the trial, age 5 to 11, had fewer systemic side effects. And when I say systemic side effects, I mean fatigue, headache, fever, body aches, the like. And in fact, kids who had evidence of previous COVID infection had fewer side effects to the vaccine overall as well. So what it comes down to, and the reason why I decided to get my daughter vaccinated and why I recommend all children age 5 and up to get the vaccine, is that the risks of COVID, the COVID virus to our kids, far outweighs the risks of the COVID vaccine. And I'd like to say that the COVID vaccine is the best way to keep our kids healthy. I also want to put a plug in that it's time to get our annual flu shots to keep our kids free from the flu this season as well. We do anticipate a higher incidence of flu than we did last year. A little bit about what we're doing at Complete Children's Health. We've been very active in the rollout of the COVID vaccine since it became available this summer. Starting in June, we have offered vaccination for our 12 and up, which included giving out over 1,300 vaccines to individuals, including our patients as well as their parents. We received a very limited amount of vaccine for this new age group, 5 to 11, yesterday. And I'm happy to say we filled our vaccine clinic on Thursday within hours for kids who are going to get the COVID shot. So really appreciate the opportunity to be here today and share a little bit about my strong recommendation to get 5 and up vaccinated against COVID and why I chose to do that as a parent as well.
Thank you, Dr. White. Our pediatricians play an important role in sharing factual health information with parents and expanding vaccination opportunities for children in our community, as you heard Dr. White mention. The clear information about COVID-19 vaccine helps guide parents in understanding the vaccine and making a decision about what's best for their child. I want to share a little bit about Eva Aola, a parent and a vaccine outreach coordinator at El Centro de las Ameritas. She brought 2 of her children to Saturday's clinic and shared why she decided to get her children vaccinated.
As a parent and as a vaccine outreach coordinator with El Centro de las Americas, the Hispanic Community Center here in Lincoln, I do think it's very important for us to get our children vaccinated and all of our household members vaccinated who are eligible for the vaccine. Unfortunately, our household did come down with COVID in December, and it was very traumatic, scary. As a parent, you don't know what to expect from COVID. I have children that suffer from COVID PTSD, and this is just another way for us to get back to normalcy and have the children be children again.
As a mom,
it gives me a sense of relief. Why? Because my 10 and 7-year-old are the youngest of our 5 children in the household, and they were the last ones to be vaccinated. And we knew that we were still carrying that risk that we could come into the household with COVID and still spread it to them. And they weren't going to be, basically they weren't going to have that sense of security that they were vaccinated.
Years old in Lancaster County, as I mentioned last week. Getting them vaccinated helps keep them healthy and can aid in our community's progress in this fight against the virus. We have several upcoming clinics for children 5 to 11 this week. On Wednesday from 4 to 7 p.m. we'll be at the Waverly Community Foundation. On Friday from 4 to 7 we will be at Norris High School in the gymnasium. And Saturday from 9 to 2:30 p.m. we'll be at Lincoln Northeast High School, also in the gym. Parents and guardians can complete the quick and simple registration process and schedule an appointment online at covid19.lincoln.ne.gov. We're also contacting those with children already in the registration system to schedule an appointment. People who don't have online access or need assistance can call us at 402-441-4200. We're also working closely with our pediatric practices in our community. As Dr. White mentioned, we provided them with the children's COVID-19 vaccine, and some local pharmacies are also offering the vaccine as well. Vaccination data for 5 to 11-year-old is now on the COVID-19 dashboard at covid19.lincoln.ne.gov. You can also find the percent that initiated vaccination under the percent population vaccinated tab, and the percent fully vaccinated under the vaccination demographics tab. We've also updated the dashboard to reflect the percentage of the entire population fully vaccinated, which currently stands at almost 61%. People in our community are getting vaccinated every day, and we continue to work with various partners to host clinics so you can get a first dose, a second dose, or a booster dose. Our COVID-19 vaccines continue to help prevent severe illness, hospitalization, and death. But there is now clear evidence that the level of protection can decrease over time. This is why the CDC approved booster doses for all 3 COVID-19 vaccines. Pfizer and Moderna booster doses are currently approved at 6 months after the second dose for the following groups: people 65 and older, and residents in long-term care facilities or assisted living. People age 18 to 64 with underlying medical conditions that put them at higher risk of severe outcomes from COVID-19. These are people who may be taking chemotherapy or have an immune system problem or another serious lung condition or other health problems. We really urge them to get a booster dose. People who work or live in settings where they have increased exposure to COVID-19, like first responders, teachers, grocery store, and manufacturing workers. Booster doses are also recommended for everyone who received Johnson & Johnson vaccine 2 or more months after the initial dose, regardless of their age. Locally, more than 40,000 people have received booster doses or third doses, and this is really encouraging. Just over 23,000 of them are 65 years and older. But there are close to 19,000 people 65 and older who are eligible for a booster dose that haven't yet received it. We strongly urge every person who is eligible to receive a booster dose to get one as soon as possible. We are seeing more breakthrough cases. 34% of the cases in the past 4 weeks were in people who were vaccinated. That booster dose helps boost the existing protection people already have against COVID-19. More information and upcoming clinics can be found on the COVID-19 webpage. Several local pharmacies are also providing booster doses, and many offer all 3 types of COVID-19 vaccines. Find a pharmacy near you at vaccines.gov or by texting your zip code to 438-829. Some new development on boosters that just happened prior to the briefing today is being reported that Pfizer asked the Food and Drug Administration for authorization for booster doses for all adults. We will be monitoring this situation closely and continuing to provide information as it becomes available. In our local situation, we need to look at the data for an update. Our risk indicators continue to move in the wrong direction this last week. Cases are increasing in many surrounding states, and we're seeing increases across Nebraska, including in Omaha and here at home. For most of October, new cases have leveled off at about 80 per day. However, over the past 2 weeks, new cases have been increasing again. On the chart, you can see that the 7-day rolling average increased to 105 cases per day towards the end of last week. Along with an increase in cases was an increase in the positivity rate, 11.2% this past week, ending November 6th. Our hospitalization numbers remain high. The high case numbers and positivity rate continue to impact the hospitals. The 7-day rolling average of COVID-19 patients remains elevated. Local hospital capacity continues to be a very serious concern for our entire community. For nearly 3 weeks now, the number of COVID-19 patients has stayed around an average of 90 patients per day, with over half of them from Lancaster County. Our hospitals remain stressed, and we want to see the number of COVID-19 patients drop to provide some relief to the medical professionals and to make sure that those who are sick or injured can be taken care of quickly. Today, the hospitals report 91 COVID-19 patients, 54 of whom are from Lancaster County. We are also reporting 1 death, a man in his 20s. And sadly, we lost 8 members of our community to COVID-19 so far in November. Due to the increase in new cases, our high positivity rate, and our strained hospital capacity, the COVID-19 risk dial remains in the low orange category. And as you know, orange means there is a high risk of COVID-19 spread and impact in the community. On the color-coded risk map, you can see the indicators spread across the different risk categories. Our local positivity rate and case rate both remain in the red category. Hospital capacity and death remain in the orange category. Contact tracing is in the yellow category, while testing turnaround time and vaccination rate are in green. The position of the dial is shown by the blue square outlined in red, which can be seen in the low orange area. Our risk dial provides a summary of current conditions in Lincoln and Lancaster County, and the data shows our local situation is concerning. While we remain concerned about the trends in our data, we want to highlight the hope that recent vaccination developments bring. The ability to vaccinate children 5 to 11 years old is a major step forward for our community. Children who are vaccinated are children who are protected, which slows the spread of the virus and aids in our community progress. Getting vaccinated, and that means receiving your first and second dose and a booster dose if you're eligible, and wearing a mask, are actions we can take to help reduce the risk of COVID-19 in our community. One last way we can promote health and well-being in our community as we enter flu season is to get vaccinated for the flu. As Dr. White mentioned, the flu vaccine is recommended for everyone 6 months and older and is widely available in our community. Getting flu vaccine provides protection from the virus and helps preserve hospital capacity during this pandemic. Wearing a mask and some of the other actions that help provide protection against COVID-19 will also protect you from the flu and other respiratory illnesses. And with that, we'll take any questions.
Hi, Pat. It's Matt Olberding from the Journal-Star. Hi. Do you happen to know how many kids 5 to 11 have been vaccinated so far with their first dose in the county?
I don't have the full county number. You know, our pediatrician, as Dr. White said, just started scheduling this week. But on Saturday, we provided over 1,500 doses.
And the breakthrough case number that you provided, that's seems fairly high. Are you concerned about, do you happen to know if most of those cases are in older people or are they across the population?
In the older age group, Matt, and I don't have the numbers in front of me, but that was something I was looking at yesterday, so I don't want to give you the wrong numbers, but we're primarily seeing those breakthroughs in that age group. We can get back to you with that.
Gotcha. And we say that getting that booster shot, if you're eligible, is as important, if not more important, than getting kids vaccinated?
It's as important. It's those two things that are going to really help us move forward in the community. They're equally important. And we really urge, you know, it concerns me when I see people that are 65 and older, judging from the cases that we're seeing, where there's any breakthrough or, you know, in our assisted living facility that we were just talking about a couple weeks ago, that could have been a really effective tool in preventing some of that. So they're both equally important, and we're really focusing on that to really help us.
And do you feel confident or optimistic that as more of those, the younger age groups get vaccinated and the people who are eligible get their third doses, that'll help, you know, kind of bring the case rate down and the hospital numbers down?
We feel very hopeful for that. You know, the thing that concerns me is, you may have seen that the governor has again brought up the dashboard because our hospital capacity statewide is over 10%. And I was just with many of our local health directors, and they're all seeing increased cases across the board. Where they don't see them so much, there's many schools that have mask mandates in place in some areas and not in other areas. And we've had some recent school closings as well across the state just because of the number of individuals that are COVID positive among the students. So it is really critical. One of the health directors told me their primary increase that they're seeing is in that 5 to 11-year age group. So just some information to share with you to give you a perspective.
All right, thanks.
Pat, we have from KLKN, and they're asking, recently we have seen quite a few deaths in Lancaster County with vaccinated individuals. Has this been a trend the health department has noticed?
Yes. And we've been looking at those, and just to give you an idea, the vaccinated individuals were in their late 70s and in their 80s. So when you see that number, that is concerning to us. And many of these were fully vaccinated. Not all of them had their boosters. But on the other hand, we have 3 people ranging from the age of 20 to in their 60s that have died that were unvaccinated. Okay. Thank you for joining us today. Be sure and get vaccinated, get your booster. There's easy ways to schedule. Most of the clinics are pretty full for Waverly and Norris, but there's still some space available and some space for Northeast High on Saturday for children. And there's plenty of places to go at our local pharmacies or at the health department if you need a booster as an adult. Thank you.